So the collaborative problem solving now. We want to always have this collaborative approach with patients, but there are times when we may have to give direct instructions. For instance, if we walk in on a patient or a patient comes into us and they have a glucose of 60, it's not time to sit down and say, well, why do you think your glucose is 60? No, we need to treat it right away. So we'll treat the glucose, the low glucose right away. Once we've gotten the patient out of the crisis, then we can collaboratively talk about it. Okay, why do you think your glucose was low? What do you think you could have done differently? Okay, and then the other thing is we call it SMART steps. You know, any goals that we have with patients, we want them to be specific, measurable, attainable, realistic, and a timeline. So for instance, if a patient has junk food every day at 3 o'clock because they're sitting in front of the TV, and this is what they enjoy doing, how do you think it'll work if we tell the patient, okay, you can't have junk food anymore at 3 o'clock. You're going to go back into the hospital. You need to have a healthy snack every day at 3 o'clock. How do you think that's going to work? Right, it's not. Okay. But if we say to the patient, I know you enjoy, having your snack every day at 3 o'clock. Do you think on 2 days you can substitute your snack for a piece of fruit? 2 days. Oh, 2 days? Yeah, I could do 2 days. That's more realistic. And then maybe 2 days goes into 3 days and 3 days goes into 4 days. That's how we handle that. Another thing is we want goals to be specific. So if a patient says to us, I'm having trouble taking my medication, I'm not really sure what that means, so we need more information. So then the patient says to us, well, I remember to take my morning medication, but I have difficulty remembering to take my evening medication. Okay, so then we know, okay, we have to give them some interventions for the evening medication. And again, I'll try and get that from the patient first. What do you think will help you to, take your medication in the evening? I always like to try and get it from the patient first. They have the answers, okay? And again, if they don't, then we help guide them, and we give them the answers. The other thing is with relapses, you also want to focus on positive self-talk. This is when patients feel guilty. They didn't follow through. What's the sense? I might as well not even try. I'm just going to fail. So we want to focus on the positive self-talk. It's okay. It's okay. Let's look at what we could do now. I like the saying, our greatest weakness lies in giving up. The most certain way to succeed is always to try just one more time. So we want patients to feel comfortable with these relapses and how can we get back on track. We don't want to have this punitive approach with them when they do relapse.